Before I begin, Amiteshwar ji ne bataya, I did my education, completed it in India from Jawaharlal Nehru University, and यहाँ पे मैं पिछले 3 साल से पढ़ा रही हूँ. And I've been teaching various courses in international relations, global political economy, and globalization. So I'd like to begin with a disclaimer. I'm not really an expert on global health. My major or specialization during my PhD was international organizations. So I've studied international organizations and how they act in the international system and what is their role. So when this pandemic started, there was a lot that was being said and talked about the the World Health Organization. I worked on the World Trade Organization, so pardon me if I go back to calling the WHO as the WTO, but I'll be talking about the WHO today. I was interested in finding out more about the World Health Organization, reading and listening to all the criticisms and all the problems that the WHO was facing in handling the coronavirus pandemic. I thought, is this an organization that is relevant in any way today? I mean, also, I got curious about the history of global health organizations. So I started reading up on it, and this is what I have been able to research and find out in the past 3 months, since we all have been shut down in our homes. Today, looking at the brief contents of this talk, we'll start with the pre-WHO history of global health governance. कहाँ से global health organizations की शुरुआत हुई before WHO era. And then we'll come to the WHO, look at how it was established, what are its objectives and functions, various aspects like membership, governance, financing, and also in brief, I'll look at the major achievements and failures. So I'll be mostly looking at the WHO's work in containing the spread of infectious diseases. I'm not going to go into non-infectious diseases because that's something that I have not really gotten to until now. And then very briefly, we'll look at the main criticisms of the WHO, WHO's response to the ongoing COVID-19 pandemic. And of course, we cannot overlook the most recent development about the organization, which was the announcement of the United States to officially withdraw from this organization. So we'll talk briefly about that as well. So going to the pre-war era, and this is something which is not just true for today, but also for times like the 14th and the 13th century. Paul Russell, he was a specialist in malaria and tropical diseases, and he said that nothing on earth is more international than disease. So as human beings started moving from one place to another, we see that they took with them not just their history and culture and language and food and other things, but also the diseases or the disease-carrying agents that their bodies were carrying. So this is something which started very early, and primarily the need for global health organizations was felt because of pandemics like cholera, yellow fever, plague. Now, in those times, these diseases were not very well understood, but nevertheless, they did spread rapidly, and because of this lack of understanding, we see that these diseases were really fatal. So it was felt that it was since these diseases do not respect state boundaries and spread from one region to another at a very fast pace, it was important for countries to come together to contain these diseases. And hence, the need for organizations that brought these countries together was felt. Uh, the very informal beginning of global health uh, governance can be traced to the beginning of this practice of quarantine that uh, that is almost the buzzword today. Everybody's we even have memes and jokes about it. So how did this begin? This was something which was started as a trial and error thing, when diseases were spreading, and these diseases were spreading primarily along trade routes. They say Silk Route developed, and Europeans and Americans started trading with the Eastern Hemisphere, and that trade increased with the development of trains and with the use of large steamships to carry cargo from different parts of the world. Uh, it was felt that, when these traders and sailors came from other lands, they also brought diseases. And in order to, and if there was some suspicion of spread of a certain disease, they invented this practice of setting them aside or quarantining them for some period of time. The period was set randomly as 40 days, and the underlying reasoning was ki if you set these uh, people who might spread a deadly disease in the mainland for a period of time, either the disease will play out its entire time period and will get over within these 40 days. Or the other thing is that maybe the virus or the disease carrying agent will not survive for this longer period, and it will die away if it doesn't harm the people who are carrying it. So in any case, the idea was to make sure that these disease carrying agents do not enter a particular country or area. And so this was something which started as early as 1403. Venice was the first country that established quarantine stations. And these stations were established at either isolated islands, or some buildings were assigned as quarantine buildings, or even sometimes ships were left at the harbor, and people were not allowed to disembark, and they were required to quarantine on the ship itself. So, of course, this kind of an informal beginning was not very successful in containing the spread. So, more formal methods or formal mechanisms were developed. So, the beginning was these meetings that were held, or that were primarily organized by European countries and were attended by them. So, the first international sanitary conference was held in 1851, and the prime objective of this was to deal with the spread of cholera, and to uh, find out whether people who are suspected of carrying this disease should be quarantined or not, and if they should be quarantined, then what procedures should be followed. There needed to be some uniformity in those procedures. So this particular conference produced a document which was termed as the 1851 Convention, and annexed to this convention was an elaborate document containing 137 articles, which was termed as the International Sanitary Regulations. Now, these were rules that were related to how a quarantine should be conducted, and what steps should be taken to handle these diseases. But this particular convention, this document was not adopted. 1851, it was finalized, but it was adopted by only towards the end of the century, by around 1892, when the 7th International Sanitary Conference was held in Venice. So the reason why this delay happened was because of various concerns among countries related to making an international commitment. Now, there were 12 countries from Europe that participated, and all these countries had very different health systems and ways of dealing with a particular disease. So there's no uniformity. Arriving at standard regulations was not easy. Also, most of these health ministries were within a part of either the Home Ministry or the Interior Ministry. So they did not really had the authority to make an international commitment, because that required, that came with certain international obligations. So because of these issues, we see that right from the beginning of global health governance, politics has been an important factor in how global health governance has progressed. There were 13 more conferences that were held after 1851. So, and these went on till 1938. So we see that these conferences were very useful in establishing a network of doctors, medical officers, researchers who were studying these diseases, and also diplomats and government officials who were making policies related to global health. The other thing that these conferences did was they pointed out towards the need for more permanent organizations. So we see that various health organizations came up, and these were not really global in nature to begin with. The first organization that we see being formed in the area of global health was called the Pan American Sanitary Bureau. It was later renamed as the Pan American Sanitary Organization. Then we see that a European organization came up called the Office International Hygiene Publique, that was based in Paris and primarily consisted of European membership and participants. उसके बाद First World War जब खत्म हुआ, towards the end of the First World War, we see 1918, it was the time of the Spanish flu. So again, the League of Nations was established, but the need was felt to have a global health department to deal with these diseases of global nature. And later, we see that UN Relief and Rehabilitation Administration was set up to deal with the aftermath of the Second World War, and it gradually branched into health and medical assistance for various countries. And one organization that I'm going to mention here, where we're not really going to elaborate upon it, was the International Health Division of the Rockefeller Foundation. Now, we're basically looking at intergovernmental organizations, and this was a private organization, but it did play an important role in the initial phase of the development of global health governance. So Pan American Sanitary Bureau, as the name suggests, it was primarily formed to look at or coordinate quarantine procedures in the American states. शुरू में they were in the beginning they were just looking at the Southern American states, and gradually it expanded to cover both the Americas. Uh, and gradually it was subsumed in the UN system and is now a part of WHO. It acts as the regional office for the Americas of the WHO. OIHP was very much European in nature, but it gradually expanded to cover a large number of countries. Around 60 countries joined gradually, and the prime objective there was to collect and disseminate information related to communicable diseases. Now, it's very important. Data is something that we give a lot of importance to today. We live in a data-driven world, but even at that time, it was very much needed, because only then was it possible to formulate standard procedures to deal with the problems that were coming up due to these diseases. So awareness and data collection was an important aspect, which started from the early 20th century. Uh, Health Organization of the League of Nations, it gradually, from looking at international spread of diseases, it gradually started adopting the socio-medical approach to global health, which basically looks at health as a holistic thing. It's not something that should be dealt with by doctors or medical professionals, but it also is affected by things like nutrition, hygiene, housing, living conditions, financial situation of a particular person or family. So gradually we see that the Health Organization of the League of Nations branched out into these areas of social medicine. The Relief and Rehabilitation Administration, set up by the UN, it started as an organization to provide relief and rehabilitation to people affected by war, but gradually it was felt that most of these people were suffering from various diseases and illnesses. So it gradually expanded its work to provide health assistance, and which was very much needed in a lot of low and middle income countries. So if you look at these organizations, by the end of the Second World War, it was felt that it's absolutely critical to have a global health organization. So in 1945, the San Francisco Conference was held, in which the United Nations was established, and in that particular conference, it was discussed that a global health organizations should be established, and it was unanimously approved. This particular resolution was approved at San Francisco. Uske baad, we see that they started working on a constitution for this Global Health Organization. And at that time, the word global was emphasized instead of international to show the truly worldwide character of this organization. So 1946, there was a conference in New York where the constitution of the WHO was approved, and it was signed by 61 countries on 21st July. Immediately after that, the first thing that happened was establishment of an epidemiological information service. Now, the purpose was here to track information on diseases and see that whether international sanitary regulations are being followed in dealing with these diseases. So that was the first thing that the WHO started on right after its establishment. In fact, it was not really established at that point of time because the constitution was not ratified by all the member countries that had signed it. So that happened by 1948, when we see that the first World Health Assembly was held, and the constitution of the WHO, after being ratified, came into force on 7th April 1948. So this particular organization, what happened to the previous organizations that were already there when the WHO came up? Now, three of those organizations, the Pan American Sanitary Bureau, OIHP, and the Health Organization of the League of Nations. These three organizations were dissolved and they were absorbed into the WHO. And WHO was the first specialized agency of the United Nations, and the first director general of this organization was from Canada. He was a Canadian psychiatrist and a medical practitioner. He was also somebody who had contributed to the First World War. He was a war veteran. Now, what was the objective of this organization? And if you look at this particular article, attainment by all people of the highest possible level of health. Now, this is a pretty lofty objective. It seems like you are aiming for the moon here, but here it was something. This objective is truly reflective of the global nature of the organization, and it was recognized that it's not just important to address health issues in a handful of developed countries in North America and Europe, but it was needed more so in the developing countries of Asia, Africa, and the Middle East. So this was in some way a recognition of the fact that health is in a way a fundamental right which should not be denied to the millions of people who are living in low and middle income countries and are caught in the cycle of poverty and ill health. So we see that this organization that was set up had a lofty objective, and hence its work program or its functions. If you look at the WHO Constitution, it has the second article, Article 2, which lays down its functions in 33 points in great detail. But if you look at them and process them, they can be categorized into 6 broad categories. The first is providing leadership in directing and coordinating international health work, establishing collaboration, assisting governments, then shaping the research agenda, or what are the areas in which new research is needed and how should it be conducted, and how should the collaboration between various countries and researchers take place for this kind of research. So this was something which is something that the WHO majorly focuses on. Third was establishing standard norms and procedures, and also making sure that the varying health practices in different countries do not undercut each other. Because if you have one particular disease you're dealing with in several areas, you can having a standard way of dealing with it will minimize a lot of cost and time that is spent in dealing with it. And this required articulating various policy options. What should the governments in these member countries do? What kind of health policies should they have? What are the uh, kinds of health systems or health departments they should set up? And the last two functions are more technical in nature, monitoring and surveilling the spread of these diseases, and providing support, technical and financial, to various countries that need such support. So WHO, when it started, it had around 60 something members that signed the constitution. But today we see that it has grown into an organization that contains almost the entire world, 194 member states, except a couple of member states which are either a principality or have been incorporated in other ways. And the process by which a particular country becomes a member is you basically sorry, Amiteshwarji, can you please mute? I think the okay. The process by which a country becomes a WHO member is that you ratify, your legislative body ratifies the constitution of the World Health Organization and agrees to follow all its regulations and fulfill all the country's obligations which come with becoming the WHO member. If you look at the governing bodies, it's fairly simple. World Health Assembly, which is the general body of the organization. It's the highest decision-making body, which takes all the major decisions, approves the budget, appoints the Director General, and it instructs a smaller body called the Executive Board in all matters. Now, the executive board is a smaller body and is basically charged with the responsibility of finding ways to implement the decisions that are taken by the World Health Organization. So it consists of technically qualified experts in the field of health, and these people are elected for a term of 3 years. So together, the executive board and the World Health Assembly set the agenda, global health agenda, and find ways of implementing that agenda. The organization is led by the Director General, who is elected by the World Health Assembly, and he serves a 5-year term. Now, he is charged with the responsibility of providing leadership and guidance in all matters of the functioning of the WHO. Apart from these bodies, we also, bodies and officials, we also have almost 150 field offices in various parts of the world, which coordinate the work of the organization. And they have regional offices which enjoy a large amount of autonomy and are basically responsible for different parts of the world. So we all are familiar with the present WHO Director General, Dr. Tedros. He assumed office in 2017, and he is the first African person to hold this office, and also the first non-physician. He's a microbiologist, and he's also served as a government minister in Ethiopia in 2 separate departments. So he his way of work was a lot relaxed and a complete contrast to the formal manner of working of his predecessor, Margaret Chan. So that was something which was remarked or talked about when he took office and started working as the Director General. He's also somebody who has been putting universal health coverage at the top of his agenda. So he just like the objective of the global health body, provide health for all, best possible level of health for all. The focus of the Director General is also pretty wide in this manner, because it's not easy to think about universal health coverage. There's so many issues there. So now financing is something been talked about a lot in recent times. So how does the WHO finance itself? Where does its funds come from? Now, there are two primary ways in which WHO finances itself, and these ways, the contributors are member states, as well as various other international organizations, private philanthropic organizations, non-governmental organizations, so the all kinds of bodies that are contributing to WHO financing, even if they are not a member of the WHO and do not have a great say in the policies that this body is making. So the assessed contribution is something which is like a membership fee for all the countries. This is something which is set at a particular percent of a country's GDP. And it varies for every country. It's not the same for everybody. And this is something which is agreed upon at the UN General Assembly. And every 2 years, WHO has a system of biennial budget, which biannual budget, which is approved at every 2 years, and members look at their contributions and ratify it. The other is voluntary contributions. This can come from anywhere and any organization, and this has become more and more important, because we see that voluntary contributions today cover 80% of the total WHO budget, while the assessed contributions made by its member nations covers only 20% of the budget. Apart from these facilities, there's also a small WHO foundation which was launched in May this year. This is something which is a very recent development. It is primarily aimed at facilitating contributions from the general public and individual major donors. So it's a very new initiative, and it still is being formed and figured out. So if you look at the funds of the WHO, where they are coming from, we see that voluntary contributions are providing a large amount of its resources. Voluntary contributions are also not, they're not very uniform. There are three kinds of contributions that these voluntary donors make. And that difference between these three kinds basically depends upon the manner in which these funds are spent. So the core voluntary contributions are completely unconditional. WHO can spend it in any way, and these are made mostly by the member countries of the WHO. the thematic and strategic engagement funds. This is something which is not completely unconditional, so it's partially flexible. Most of us, a major share of these funds are used for reporting and accountability purposes. So uh, they are part of it is specified for these purposes, while there are certain portion of these funds in which the WHO has some discretion in terms of spending it. Uh, the specified voluntary contribution. This is something which has become more and more relevant and has grown to a large share of the total WHO funds. This is something which an organization makes, and while making this contribution, they specify the purpose for which these funds will be used. So these are uh, clearly earmarked for specific purposes, and we see that over time 90% of all voluntary contributions are specified. The other two constitute a very small proportion of the total voluntary contributions that are being made. So if you look at uh, the voluntary contribution of the share of voluntary contribution in total WHO funding, we see that this is something which has far outstripped the assessed contributions made by countries. And almost 80-90% of the WHO's funds are now specified for various purposes, and these are also coming from large non-governmental organizations or privately owned bodies which are operating in the area of global health. So foundations like the Bill and Melinda Gates Foundation, or foundations owned by Mike Bloomberg. These are the organizations that are providing a large chunk of these voluntary contributions, and hence they require these funds to be spent in specific areas. For example, we see that Bill and Melinda Gates Foundation is the largest non-government donor of the WHO. Its contribution is larger than several countries. It's the third largest donor, and it has been contributing around 250 to $300 million every year. And they have attached greater priority to eradication of polio and certain diseases. So these are the areas where we see WHO has done extensive work and has made significant progress. So we see that the agenda of the World Health Organization, which is a global intergovernmental organization, is kind of being driven by these private bodies, which are not really a member of the WHO. So it's it's a situation that the organization cannot do anything about because it needs funds. You cannot say no to these contributions, and hence, they have to agree to giving a greater say to these organizations in setting the global health agenda. Whether or not it uh, aligns with the larger goals of the WHO, that is completely another matter. This is something which has been happening, and hence we see that a lot of responsibilities that are being conferred upon this organization, they're not really in congruence with the resources that they have. Okay, if we look at the total share of various countries in uh, financing the WHO, the developed countries have had a greater say in this regard, and hence they are the ones who have driven the agenda of the organization. So, US, UK, Germany, Japan, EU, these are the countries that have been major donors and have also been making significant decisions in this organization. Apart from this, we also have several intergovernmental and private organizations, but most of their contributions are specified voluntary contributions. So we see that the US is the largest donor of the WHO. And if you look at the top voluntary contributions made by the US, again, it provides a larger share of voluntary contributions than its assessed contribution. And this is something which is indicative of the fact that, again, the funds at the disposal of the WHO are not spent in a manner that the organization wants to spend. It is determined, it's spent in a manner that these donors or countries want to spend in. So this is something which has emerged as an major factor or major concern in the functioning of the World Health Organization. It can be said that this organization has a huge agenda, while its discretionary resources or funding is quite limited for fulfilling that large agenda. So let's look at the most important achievements and setbacks of this particular organization in terms of dealing with infectious diseases and their spread. Now, here we see that the initial decades were better in a lot of ways, and the organization was able to eradicate diseases like smallpox, polio, and this was, especially if you look at smallpox, this was a disease for which we already had a vaccine long before the WHO was established. Yet we see that there were recurrent outbreaks, and when there was another outbreak towards the middle of the 20th century, it was decided that it was time to focus on eradicating this disease completely. So 1966, may we see that an international team was formed, and smallpox eradication unit was set up. And from that time onwards, the WHO started contributing a large chunk of its funds towards eradicating smallpox, annually around 2.4, 2.5 million. In that area, it started spending to deal with vaccination and surveillance of smallpox. So this can be counted as one of the achievements of the organization. The other achievement was in terms of polio eradication. Now, WHO has achieved near complete eradication of polio. This is something which, if you look at this particular map, out of the 3 strains of polio, 2 strains have been completely eradicated. Only the strain that is termed as type 1 is something which is still there, and around 94 cases of this type 1 polio were reported last year, mostly in Pakistan, Afghanistan, and Nigeria. So it's again another huge success of the WHO. India has been one of the countries that has had a large number of polio cases. So we see that uh, around a few years ago, in 2018, India declared itself to be polio free, and that was something which was a huge thing, which could not have been possible without the assistance of WHO in terms of its vaccination programs, in terms of assistance provided in treating the disease, and training people to deal with this disease. Now, the other pandemic that the WHO dealt with was SARS. Let's start with tuberculosis. Tuberculosis is a disease which the WHO has been dealing with, and it has not been very successful. We still have millions of people who are falling ill. Around 10 million people got this disease in 2018, and we see that it has been among the top 10 causes of death in the entire world. So this is a struggle for the World Health Organization, but it does have the WHO has made an impact in terms of providing medicines for treatment of tuberculosis through the Global Drug Facility. We see that they've formulated or put in place various collective purchasing mechanisms that bring down the cost of medicines. Okay, we need to mute the. Sorry. And it also provides assistance, financial assistance to poor countries to buy these medicines and to look at better ways of treating the disease. Now, so tuberculosis is not exactly an achievement, but it's not really a failure either. WHO has been making a significant impact in reducing the incidence of this disease. Swine flu. Now, these are pandemics where the record of the WHO is not completely positive. Now, in 2009, it was expected that there's going to be an outbreak of swine flu, and this outbreak was expected to be much more deadlier because it was felt that the virus might mutate and assume a more deadly form. So in anticipation of the situation, the WHO declared swine flu to be a public health emergency of international concern in 2009. We'll talk about the criteria for declaring this PHEIC when we talk about COVID-19. And because of this declaration, we see that there was a huge rush to purchase medicines and vaccines for treatment of swine flu. But what actually happened was that the virus did not mutate into a deadlier form, and the epidemic was much more milder than what was expected. So this was something that was widely viewed as a completely disproportionate response to a situation. And WHO, various criticisms were pointed at it, and the biggest was that it was accused of being driven by interests of pharmaceutical companies and who are primarily from the richer countries. So this was something which uh, was a learning experience for the World Health Organization. Another incident was that of Ebola, where we see that it was felt that after the incidence of swine flu, WHO was very cautious in declaring Ebola as a public health emergency of international concern, and it was the delay in declaring was really long and happened despite several warnings from uh, different countries as well as officials of the WHO itself. So this was again viewed as a big failure of the organization, and its performance was compared to various non-governmental organizations like Doctors Without Borders, who responded much quickly and effectively in containing this. WHO's handling of Ebola has also been applauded by some sections of the researchers and global health professionals. So this is something which, again, if you look at the handling of these various infectious diseases by the organization, we can say that it has had a very mixed track record. It's not something which has always been successful, or there has been a learning curve for the organization in terms of dealing with specific diseases and formulating rules and regulations for dealing with them. Coming to the present COVID-19 pandemic, this is something which started in late 2019. If you look at the timeline, it started in Wuhan, China, and December 8th, 2019 was when the first patient was reported as developing symptoms of strange pneumonia-like symptoms. By the end of the month, this was happening on a large scale, and China alerted the WHO about it. January, we see that Wuhan was the seafood market from where this particular disease was said to be originating from was completely shut down. And later in January, we see that the entire province, Wuhan province, was quarantined and shut down and cut off from the rest of the world. So in January, we see that the WHO Director General visited China, and he was quite appreciative of China's role and in dealing with disease, and it was not in too much of a hurry to declare this disease as something which needed international concern. So let's look at these two major criticisms of the WHO's response. Slow in declaring it as a public health emergency of international concern, and appeasing China in terms of not criticizing or pointing out the weaknesses or drawbacks in the initial phase of the disease and how China dealt with it. So when we talk about declaring a disease as a public health emergency of international concern, this is something which after the Ebola incident, WHO learned from it, and they after the 2002 incident, it learned from it, and they formulated elaborate rules for declaring a disease as a public health emergency of international concern. So two important conditions were formulated. One, that there was a considerable risk of this disease spreading from one country to another. And second, because of this kind of a spread, it was important to for countries to coordinate and cooperate with each other to handle this disease. So declaring a disease as a public health emergency of international concern was something which was viewed as a last resort option for the World Health Organization. Also, this was because of the previous criticism of its early declaration of swine flu as a public health emergency of international concern. WHO was very apprehensive, and it was important to make sure that the criteria set for this declaration was followed. And the criteria included referring it to a body of experts who are consisting of various medical professionals. And this was can you please mute the 8 minutes. Okay, thank you. WHO has been more cautious in making such declarations, and even while being cautious, if you compare the time of response as compared to the 2002 SARS outbreak, we see that WHO was cautious, but still not very much slow in responding to this. This particular graph compares the response of global bodies and countries to the SARS outbreak and to the COVID-19 outbreak. And we see that if you look at the COVID-19 outbreak, from the first patient being declared in December, being identified in December 8th, to the declaration of the public health emergency of international concern on 11th March, almost, within a span of 3 months, a lot happened, and it was declared as a public health emergency of international concern. While if you look at the response to SARS, it took nearly a few months for the SARS outbreak before being even identified as a disease. There's this huge time lag. 3 months passed before this outbreak was identified as a distinct disease, and then we see that another 2 months passed before which the disease-causing agent was identified. So if you compare the WHO's response to COVID-19 with its response to SARS, we see that it was not very as slow as it has been. You know, the critic has been a little too harsh in criticizing the organization. The other problem of appeasing China. Now, the Director General said that China had set a new standard for outbreak control, and in January, and a few days later, he said that China's actions actually helped the rest of the world in preparing to deal with this outbreak and bought the world time. Now, this is something which has been I feel it's something which has been a valid criticism. It's not completely unfounded, and it does have some substance to it, because the early handling of the disease in China, if you look at it, they did cover up data, they did try to silence the doctors and the professionals who were reporting this disease. The Director General did not pay any attention to these incidences. Also, late in declaring person-to-person transmission, and the WHO relied on the Chinese officials and took all that they were saying at face value. Now, this is something which has been termed as over-reliance on data and information coming from China by the WHO. And researchers at the Harvard University, Ashish Jha, is somebody who often is seen in interviews and other discussions taking place on various news channels these days. He does point out that this was an error, and it was also, he also talks about Taiwan and the importance of looking at the evidence that was coming out of Taiwan about human-to-human transmissions around that time. So this was, this has been viewed as a valid criticism by a section of scholars and researchers. There's another view of some scholars who say that the strategy of the WHO Director General is to coax China to become more transparent and more compliant with international norms. Now, it's important to understand that the World Health Organization is an international organization. It cannot, it's not really a world government. It cannot force countries to do something or prevent countries from, doing something. It basically it can direct advice and provide guidance to these countries, and on the assumption that these countries in good faith will follow this advice and guidance and cooperate and collaborate with other members to contain the spread of a disease and promote global health. But if a country openly or decides to flout these regulations, the WTO does not have any power to enforce its rules. It does not have any teeth or enforcement mechanism for it. So criticizing China at that point of time in January, how would that have progressed? Whether China would have taken it in a positive way or reacted in a hostile manner is something which is a matter of speculation. But looking at the manner in which China has responded to various trade policies that are being directed by the United States against the country, it's something which it can be said that the likelihood that China would have cooperated after open and harsh criticism from the WHO was probably very minimal. It might have resulted in more covering up data and silencing people and more harsh measures. So what is the right way of dealing with dealing with a country in a situation like this is very difficult to say. But the very recent data that is coming out also points out that WHO, if you look at the internal officials of the organization, it said that within the organization there was widespread dissatisfaction with the way China was blocking data and medical professionals and scientists from sharing things with the rest of the world. This was something which was being acknowledged by various officials of the WHO, and they were highly dissatisfied with it, but there was nothing that they could do about it. It's also recently come out that China delayed releasing information about the COVID-19 virus, and only after the information had anyway been shared with some scholars and researchers in the United States, did they officially provide and share the data with the WHO and other international organizations. So dealing with China in matters of global health or matters of trade, what is the best way? There's no simple answer. So the WHO does not have the power to make China do things, or for that matter, any other country, and hence its best bet would probably be to coax it. And you know, it's not that criticism is something which it cannot do. The WHO has criticized China when it delayed sharing information about the outbreak of SARS in 2002. So this is something which can be done, but again, you know, it depends on the person. And the current Director General has decided to follow a particular approach, which some say has not been very successful, while others say that this is the only option. So it's a matter of debate. I do not really have a conclusion about it, or, you know, I cannot say whether this was the best approach to deal with China, or it was not the best approach. Perhaps, you know, after a few years, in hindsight, people will be able to come at this conclusion. The other important event related to, or announcement related to the WHO was the decision of the United States to withdraw from the organization. Now, this was widely reported and criticized and talked about, but one matter which was not enough discussed was what exactly is the process by which a country withdraws from the World Health Organization. Is there a process? When Brexit happened, everybody knew Article 50 mein kya hota hai, and how, you know, a country that decides to leave the European Union moves from one stage to another. There's absolutely no talk about such withdrawal procedures for the World Health Organization, because there is no withdrawal procedure for this organization. If you look at the WHO constitution, it does not establish any procedure for countries to withdraw their membership. It just has one article, Article 7, which says if a member fails to meet its financial obligations or due to any exceptional circumstances, the Health Assembly may suspend the voting privileges and services to the member. And it does have the authority to restore such voting privileges later on. So in this situation, there's only one other previous instance where something like this happened. And this happened during the Cold War. Cold War period, right after the Second World War. We see that after the Second World War, the Soviet Union and a handful of Eastern European countries were completely dissatisfied with the fact that uh, they did not get sufficient funds from the US Marshall Plan. They also resented the fact that the US was in a position to hold medical supplies and facilities to these countries, and it did so in certain instances. So because of these issues, we see that in February 1949, Soviet Union writes a letter to Geneva WHO headquarters and says that, we have decided to withdraw from the World Health Organization. Now, the Director General at that time, Brock Chisholm, he pointed out that there is no provision to withdraw. So he said that, your membership can be inactive and, not really withdrawn. You can say that you're dormant members or you're inactive members of the organization. And he said that the erring brothers will have their seats waiting for them whenever they desire to mend their ways. So this kind of happened for a few years, and the membership of these organizations was in limbo from 1949 to 1955. 1955, they decided to formally return to the WHO because in 1953, Joseph Stalin passed away, and hence Russia mellowed down to a very large extent in terms of its participation in global organizations. So we see that this is something which might happen with the present situation and the United States if what the present US administration has claimed it goes through with it. But it might not also happen. But what are the implications of the fact of US withdrawal? If you look at the WHO, it is clearly a big loss of funds if the US decides to stop financing the organization and withdraws from it completely. This is something which can have adverse impact on cooperation between US and WHO scientists from other countries, and can affect the response to the ongoing pandemic as well as WTO programs to deal with other diseases. But it's not something which has adverse implications for only the World Health Organization. Even the United States has a few costs to pay or costs to incur if it goes through with the withdrawal. Diminished role in setting the global health security agenda. Until now, the US has been the world's leader in setting a global agenda in various fields, including global health. The withdrawal will mean that US will have absolutely no say in what's happening at the WHO. This is something which can also adversely affect WHO collaborating and research centers that are present in the United States. There are around 80 of such centers right now, and what exactly happens with these places is something which only time will tell if things progress as the US is claiming right now. The other important cost that the US might have to incur is related to its influenza vaccine. WHO plays a very important role in selecting and developing these flu vaccines. Every year, various virus strains are collected from the northern hemisphere and the eastern hemisphere and southern hemisphere, various parts of the world. They're brought together, and CDC and FDA, along with the World Health Organization, study these strains to develop the flu vaccine. So every year we have a new flu vaccine here in the US. So this is something which might be impacted or affected if the US decides to cut off ties with the World Trade Organization. To conclude, we can say that it's not very likely that the World Health Organization will stop existing or stop functioning if the US withdraws, or if this relationship is severed or cut off for a very long time. Uh, Especially in this globalized world that we live today, it's a highly globalized and interdependent world, and we have these recurrent pandemics and diseases coming up, outbreaks happening. So in this scenario, we see that the role of WHO becomes even more important and relevant. So it will continue to regulate global health agenda and policies and along with its members and various donors. Also, it's important to think of international organizations as not ideological bodies with lofty moral goals and objectives. These organizations are very much a reflection of the present state of global politics. They are part of the global administrative and political setup, and hence the state of the global politics will impact these organizations. So, if in the global system we have two great powers, US and China, sparring over trade and other issues, this is something which will be reflected in what is happening within various global international organizations. So uh, to improve the functioning of these international organizations, we need to pay attention to the state of global politics and try to improve the kind of politics that we see in the global system. That's not something which happens easily. It's very easy to say that, but I know that that's not something that can be done by one country or even a handful of countries. So this is something which is uh, something that is much more complicated, and there are a lot of things happen there. So that's all from me on this global health body and and its handling of the global pandemic. Uh, I think there will be some questions. We'll be taking some questions. Okay, let me start.